is Dr. Pranav Ghody. I am a consultant endocrinologist at Wockhardt Hospital. Today I am going to debunk some of the myths about osteoporosis. Osteoporosis simply means porous bones. This common condition is characterized by a low bone mass, increasing the fragility of the bones and ultimately increasing the risk of fractures. Unfortunately, there are several myths and miscommunications about osteoporosis, which ultimately leads to confusion and misinformation. Let's try to debunk some of the myths. One of the most common myths about osteoporosis is that it affects only women. While women are more likely to be affected by osteoporosis, about 1 in every 4 men above the age of 50 will suffer from an osteoporosis-related fracture. Another myth associated with osteoporosis is that calcium and vitamin D alone are sufficient to treating osteoporosis. Calcium and vitamin D are strong foundations for a bone. However, once you have developed osteoporosis, calcium and vitamin D alone are not sufficient to treat. Medications are usually required to slow down the bones from breaking further or sometimes to build new bone. In fact, taking more calcium from vitamins and supplements has been shown to increase the risk of heart issues. Another miscommunication about osteoporosis is that fixing an osteoporosis fracture solves the problem. The fact is that fixing the fracture either by surgery or stabilization is just the beginning of the solution. If the underlying osteoporosis is not treated, this can lead to chronic and long-term complications such as hip and back pain and inability to walk independently. This can also lead to another fracture, or more commonly lead to dying in the next 12 months. Another myth about osteoporosis is that osteoporosis is a normal part of aging. While bone loss occurs as we grow older, this does not mean that everybody will suffer from osteoporosis. In fact, osteoporosis could be related to certain lifestyle choices such as inadequate calcium, vitamin D intake, smoking, excessive alcohol consumption, or more commonly secondary to medical conditions such as primary hyperparathyroidism, multiple myeloma, celiac disease, or sometimes medications related to breast cancer treatment. If the osteoporosis is due to one of these conditions, treating the underlying condition can help reduce the risk of fracture. By dispelling these myths and providing you with facts about osteoporosis, I hope we can work together to reduce the risk of developing a fracture. If you or your loved one has had an osteoporosis-related fracture or has been diagnosed with osteoporosis, please consult us at Wockhardt Hospital to find the underlying problem and fix this issue. And thank you for watching this video.